Another topic is called cardiac muscle, and they are called cardiocytes or cardiomyocytes. They should be aerobic because during anaerobic activity, the person will have a heart attack. So they need a lot of oxygen. They are not under your control, so they are involuntary. They have striation, as you can see. These are the striations, and they are branched. So the skeletal muscle, they were parallel to each other, but this is branched, and they contain intercalated disc. So this is intercalated disc that separates one muscle cell from another. They have a lot of mitochondria, as you can see. That's why this aerobic, so it needs a lot of mitochondria, and you can see here the mitochondria as well. Most of them has one nucleus. Some of them may have more than one nucleus. Compared with the skeletal muscle, they all have multinuclei. And the muscle fibers, it is surrounded by sarcoplasmic reticulum, but there is no cisternae here. So there is no triad. The T-tubules are wider than skeletal muscle. Okay, so there's some differences there. So the intercalated disc, these are the intercalated discs that you can see, and it's good way to recognize and differentiate this muscle from other type of muscles. The cells are branched. You can see the branching. They are not parallel to each other. Okay, most of them has one nucleus. They have one nucleus. Sometimes maybe more than one nucleus, and they are separated from each other by the intercalated disc. So this is located in the Z line, and it contains gap junction. The gap junction, if you remember it, it moves small ions and also lipids. In this case, sodium can move from one cell to another cell, so that improves efficiency, and not all muscles cells need to be innervated by a nerve. So some muscle cells are innervated, but the other ones are activated through the gap junction. There is also desmosomes are there, that is for support and attachment of the muscle cells with each other. They have a lot of specific characteristics. One is automaticity, which means that they have their own pacemaker cells. They are similar to nerve cells that they can activate and that can change membrane potential, and that will stimulate muscle contraction. But they are also influenced by the nerves that are coming from the brain. These ones can increase or decrease cardiac activity, depends on the demand. For example, you're running, you need more oxygen, you need more muscle activity, so the heart rate increase. But at rest, you don't need that much, so your heart is relaxed and does not use that much contractility. The contraction time is longer than a skeletal muscle because you want all the blood or most of the blood to pump out of the heart, and also the refractory period is longer because the heart should be relaxed so it can get blood from the blood vessels. And if this is very short, then the heart will not fill up, and then it will affect the ejection or the amount of blood that is coming out of the heart, and it will affect the blood pressure. So heart is contracting 1/3 of time and relaxing 2/3 of the time. Also, the sarcolemma is a little bit different than skeletal muscle. Here, the sarcolemma has more permeability to extracellular calcium, so more calcium can enter the cell. In the skeletal muscle, majority of the calcium was coming from sarcoplasmic reticulum, but here from both sarcoplasmic reticulum and also extracellular calcium. So this is why when the amount of the calcium changes, especially if it is low, then it will affect the cardiac activity, and that's not a good thing because you don't want heart rate and rhythm to change abnormally. This is very serious condition.